This is part 2 of the Whipple procedure, pancreatic and anastomotic techniques. In part 1, we reviewed the duct to mucosa technique, the two-layer pancreatic jejunostomy technique, as well as the invagination technique. I mentioned the more unusual technique of suturing the pancreas in a 1 or 2 layer fashion to the posterior wall of the stomach. Well, what level 1 evidence exists as to which is the preferred method? Whenever there's more than one way of doing something, there's no clear consensus on what the best method is. There are recent level 1 evidence which did compare the pancreatic jejunostomy in the duct to mucosa versus 2-layer pancreatic J. This was a multi-institutional trial, and surprisingly, the 2-layer anastomosis yield lower pancreatic fistula rates than the duct to mucosa, but by a small amount. The way I look at this problem, however, is that it is not really related necessarily to the technique that's used or the technique that a surgeon prefers, but more on the judgment of the surgeon as to which technique may be better suited for a particular patient. As I mentioned in the first video, patients who have ducts that are greater than 3 millimeters with firm glands, my technique is to do duct to mucosa in that subset of patients. Patients who have soft glands or glands that are of pancreatic ducts less than 3 millimeters, I tend to do a 2-layer pancreatic jejunostomy or a true dunking or invagination technique, as mentioned in the first video. So in summary, I think that high-volume surgeons who become familiar with all the techniques available to them, and their judgment in choosing the proper technique based on the anatomy and the firmness of the gland, so forth, is what is most important in keeping the pancreatic fistula rate low. Most of these trials and most of the data show pancreatic fistula rates in the 10 to 12% range. Soft glands with small ducts can even have pancreatic fistula rates in the 25 to 30% range if categorized. For all comers at St. Joseph Medical Center, which is a high-volume center for pancreatic surgery and Whipple surgery, our rate has consistently been over the years less than 5%. For that reason, we continue to encourage patients seeking surgeons for Whipple surgery to be careful and choose high-volume surgeons with good results. I thank you for listening.